Did you know that a child's language skills, both oral and written, can ultimately determine their ability to effectively access and engage within the school curriculum? The majority of children do not have difficulties acquiring language, as this process is considered robust and proceeds naturally and rapidly throughout a child's life. A typically developing 6-year-old has roughly 14,000 words at their disposal, and as the child continues to progress through childhood, their language will develop further, adding an additional use and understanding of approximately 3,000 new words per year. However, this ideal language development process does not occur for all children. Approximately 3 to 5% of children are identified as having either a receptive or expressive language difficulty. A receptive language difficulty is described as a weakness in an individual's ability to comprehend language through various verbal and non-verbal contexts, including spoken, written, gestural, and additional symbol systems. A large body of literature argues that a receptive language learning difficulty may have detrimental impacts on other aspects of a child's development, such as expressive language skills, social and emotional capabilities, and behavioural issues. There is also a correlation between receptive language difficulties and vocabulary comprehension. Due to the complex nature of developing new words, children with receptive language difficulties make limited progress with vocabulary, as they are required to utilise a combination of phonological, semantic, and syntactic strategies. In addition, issues relating to attention and concentration, behaviour, and social and emotional capabilities can further impede on students' educational experiences as a result of the language difficulty. Students with poor language skills are highly likely withdrawing themselves from engaging in the curriculum due to the complexity of comprehension that is required. They also could experience stress and feelings of loneliness, as they do not have the skills necessary to maintain and develop peer relationships. However, what still remains unknown is the cause of a receptive language difficulty. Although a combination of factors such as genetic susceptibility, limited exposure to hearing language, and general development of cognitive abilities may contribute to the cause of a receptive language difficulty. According to the Australian curriculum, teachers are required to provide learning experiences that address the individual learning needs of all students. This is effectively achieved through the acknowledgement that all students are entitled to a rigorous, relevant, and engaging education that values the diverse potentials and uniqueness of each individual. Teachers have a responsibility to supporting the rights of students with learning differences through ensuring that they can participate on the same basis as all other students by personalising learning and making adjustments where necessary. School educators play a vital role in assisting with the identification of students' language difficulties to better support their learning. Poor receptive language skills are often overlooked as they are not always obvious. The oral language skills of students with receptive language difficulties may appear adequate for everyday interactions. The misinterpretation of inappropriate behaviour is another example where teachers have mistaken children's difficulties with failure to understand. Therefore, it is vital that teachers understand the ways children develop receptive and expressive language skills to effectively monitor classroom interactions, adapt and modify classroom contexts accordingly, and support the development of oracy skills. Through daily classroom observations and data recording, potential learning difficulties can be identified. The following indicators and characteristics are considered prevalent among children with receptive language difficulties and can assist relevant health professionals in their provision of effective intervention. To successfully pinpoint a child's particular area of difficulty, a full diagnostic evaluation of their receptive language skills needs to be carried out by a speech pathologist, utilising a combination of standardised tests and informal measures to compare results with expected age-level benchmarks. A widely used test for diagnosing children's receptive language difficulty is the Clinical Evaluation of Language Fundamentals Assessment. To ensure results are accurate, children's hearing and vision are also assessed during this process to eliminate the possibility of the language difficulty being caused by other possible impairments. DocRel 2017 emphasises that a collaborative partnership between both educational and health professionals is essential to effectively address children's speech, language and communication needs. It is imperative that teachers and therapists continue working together to develop inclusive strategies through developing and following an individualised educational plan within the classroom context once a learning difficulty is identified. Strategies such as purposeful eye contact, minimal instructions given, simplified language, chunk verbal instructions, repetition and clarification can be embedded into everyday classroom practices to assist with improving children's receptive language skills. An alternative approach using the response to intervention model may assist with recognising and supporting students with learning differences. The RTI model supports students through systematic intervention guided by the three-wave instructional approach. Evidence shows that it has successfully reduced the number of students who have a learning difficulty. Research also indicates that the most effective intervention for children with speech, language and communication needs to focus on semantic and phonological representation to assist with vocabulary development. Using the RTI model, explicit teaching strategies can be embedded in the Wave 2 and 3 instructional approach to assist students' phonological and phonemic awareness and develop vocabulary. Phonemic awareness skills are effectively developed when the teacher explicitly demonstrates oral blending and segmenting through encouraging students to notice what is happening with their mouth. Phonics should also be taught explicitly through a structured and systematic synthetic program that allows students to build on this knowledge through decoding, reading, comprehension, and dictated sentence opportunities provided by the teacher. Vocabulary instruction should encompass explicit guided practice of words through utilising word frames, templates, semantic webs, and Freya models to build student-friendly definitions. This will facilitate the development of clear phonological representations, creating a mental store of words and accurate pronunciation.